If you are doing BSc Biology and you think you'll get a job just because you have a degree, you are already in trouble, because in India, BSc Biology doesn't automatically give you a career. It gives you a base. That's it. But here's what most people don't tell you. There are 20 plus real job roles you can get after BSc Biology without MSc or PhD. Not random titles like research scientist, real jobs, real companies, real hiring. In this video, I'll break down the exact job roles that actually exist in India right now, what your primary work will look like in each, the salary range, the skills companies want, and which directions suit you. Before we talk careers, let's get one thing clear. BSc Biology is a 3-year undergrad degree where you study core life science subjects like cell biology, human physiology, microbiology, genetics, biochemistry, ecology, and basic lab work. So you are not just studying theory, you are building a base in how biological systems work, how the human body functions, and how microbes behave, and how lab processes are handled. The base is valuable in India, but only if you enter roles that actually use it. The first major path is pharma and biotech. The primary job here is simple. You help ensure the product is safe, consistent, and manufactured correctly by doing lab testing, following SOPs, and maintaining clean documentation. Most students make one mistake here. They search job titles like biotechnologists or microbiologist, and then they think there are no jobs. Companies don't hire like that. They hire by function, like quality control, microbiology testing, quality documentation, and production support. So the real entry-level job titles you'll find are QC trainee, microbiology analyst trainee, QA documentation associate, or production trainee. Salaries in India for fresher would be starting from 2.5 LPA to 4.5 LPA. In these roles, you are not doing research, you are doing controlled testing, batch checks, routine lab work, and documentation under strict SOPs. Pharma manufacturing runs on GMP, which means there are zero tolerances for errors. And BSc Biology helps directly because you understand microbes, contamination, sterile handling, and biological safety. Always remember, pharma rewards consistently over creativity. If you can follow a protocol 1000 times without a single error, you are the top candidate. For many of these roles, you should also be prepared for rotational shifts at night. Now, the second path, and one of the best long-term options, is clinical research. The primary job here is managing the trial process correctly, keeping documentations clean, tracking timelines, and coordinating between hospital staff, patients, and sponsors team. Freshers don't start as clinical research associate in most cases. Freshers usually start as clinical trial assistant, clinical research coordinator, site coordinator, or clinical data roles. To make it even clearer, a CRC usually works at hospital or a trial site. You coordinate patient visits, manage the trial activities on the ground, and support the doctor in following trial protocols. A CTA usually works at the office site. You support the clinical operations team by managing documentation, tracking the updates, coordinating with sponsor teams. Clinical research is basically the industry that runs clinical trials in the structured way. This includes coordinating with hospitals, handling trial documents, tracking patient visits, and ensuring guidelines are followed. Usually, the salaries will start for freshers in India is about 2.5 to 5 LPA. Skills that matter are good communication skills, documentation habits, basic Excel, and collaboration. Most companies also expect basic understanding of GCP. that is good clinical practice, which is standard guideline used to run trials safely and correctly. Your BSc Biology base gives you an edge because you understand diseases, medical terminology, basic treatment, and other logics faster. Now, if you are serious about clinical research and you want a structured path instead of figuring everything out randomly, this is exactly where our clinical research program comes in. We offer 3 months and 6 months and also 12 months clinical research programs to suit your career plan. You also get a dedicated mentorship, real industry focused training, and placement assistance. So instead of just watching videos and applying blindly, you build the exact skills companies want and then apply with the right direction. Links are in the description. Check out or talk to our course counselors today. Moving on, if you hate the lab but love biology, this is for you. Regulatory affairs is a strong career path, just like clinical research. The primary job here is ensuring the product's documents, labeling, and compliance requirements are correct before it reaches the market. This is less lab and more compliance and documentation. In this role, you make sure products meet government laws and regulatory requirements. Entry-level roles exist, but they are fewer than QC and clinical research. Salaries would be typically from 3 lakhs to 6 lakhs per annum. This field rewards detailed, obsessed people who can manage documentation without errors. Your biology background helps you because you can understand scientific product information and safety language better than most. Along with regulatory affairs, another strong corporate option is pharmacovigilance, also called as drug safety, where you track and report side effects of medicines after they are launched or even before they are launched while they are into clinical trial phase. Now, one of the fastest hiring industries for BSc Biology graduates is medical coding and healthcare operations. The primary job here is working on medical reports and insurance workflows, so claims get processed correctly without errors. Job titles include medical coder, AR caller, RCM associate, and claims associate. This exists because India handles a lot of US healthcare backend operations. And since it's US aligned work, many roles involve night shifts too. Salaries would typically range from 1.8 lakhs to 3.5 lakhs. Your advantage is you already understand anatomy and medical terminology, so you learn faster. While your bio degree helps with anatomy, many multinational companies prefer a CPC certification for better roles and serious salary hikes. Our medical coding course curriculum is designed in such a way that you get certified and start your career. If you feel medical coding is your path and want to know what roles are right fit for you, then you can join our free masterclass. Links are in the description. You can check them later. We have 2 more career paths left to discuss right now. Now, if you don't want lab work and you don't want night shifts, there's another real option: biology, content, and academic roles. The primary job here is simplifying biology concepts into content that students can understand and use. Job titles include biology SME, content developer, doubt solver, and academic associate. You will generally find these roles within edtech space, so this is another bright career path for you. Salaries typically range from 2.5 to 6 lakhs per annum. Your BSc degree gives you subject depth, but communication matters more for these job roles. Speaking of communication, I want to add on here. As we say in the industry, getting a job is one thing, performing well at job is another. And that's actually where communication skills play a major role. And that's why we offer soft skills training within our courses. And we cover corporate etiquette, interpersonal skills, and everything you need to be professional at the workplace, so that you grow in your career beyond your first job. So our final career path is pharma and diagnostic sales. This is another real route where BSc Bio grads can go after. And let me be clear, this is not random sales. This is professional B2B selling inside healthcare. The primary job here is building relationship with doctors, clinics, hospitals, or lab owners and achieving monthly targets by promoting the products. Now, when I say sales, the entry roles are not just sales. You will see job titles like medical representative, territory sales executive, business development executive, sales trainee, and sometimes product specialist in diagnostic companies. In pharma sales, you are usually assigned an area and your job is to visit doctors, explain what your medicine does, and ensure prescriptions and product demand stays consistent. In diagnostic sales, you pitch lab tests, health packages, and diagnostic services to clinics, hospitals, and sometimes corporate clients. The salary typically starts from 3 to 8 lakhs per annum, including incentives depending on company and performance. Skills required here are different from lab and clinical jobs. You need confidence, communication, follow-ups, daily discipline, and a target handling mindset, because here your results are measured every month. And your BSc Biology actually helps more than you think. Why? Because you understand the product. You can speak the language of healthcare. You won't sound clueless in front of a doctor. But just remember, sales is pressure. But if you perform, growth is faster than most of the lab roles. Now I want to save you from wasting months. You are not becoming a research scientist after BSc Biology. You are not becoming a geneticist right after BSc Biology. You're not directly becoming a wildlife biologist right after BSc. These roles exist in India, but they usually require either higher education, deep specialization, strong project experience. If you run behind fancy titles, you'll end up unemployed and frustrated. Instead, pick entry roles we already discussed in the video that actually exist and then build from there. And yes, lab support roles like lab assistant or sample processing exist in hospitals and private labs. They are stable jobs, but salary is low and growth is slower compared to pharma and clinical research paths. So let's do a recap of job roles you can target with BSc Biology degree. If you want lab-based work, go for QC, microbiology testing, or production in pharma. If you want corporate roles with long-term growth, go for clinical research or regulatory affairs. If you want fast hiring and stable entry, go for medical coding or healthcare operations. If you are good at teaching and communication, go for biology content and academic roles. But if you want high earning potential early, go for pharma or diagnostic sales. See, a BSc Biology degree won't give you a job by itself. Your job comes from combining your biology base with just one extra strength: documentation discipline, Excel, communication, process handling, or sales confidence. Pick one path, commit to it, and your chances of landing a job will multiply. That's it. Always remember, this BSc Biology gives you a base. Your career depends on the direction you choose and the skills you build on the top of it. I hope I gave you some valuable insights. If you liked this video, hit that thumbs up button and subscribe to our channel for more life science career oriented videos, and comment below which degree related videos we should make next. Thank you for watching.
Visit us today, www.clinilaunchresearch.in.